रेकॉर्डिंग ऑप्शन ऑन आहे का माझं?
नाही इथून रेकॉर्डिंग चालू.
मग मी कशाला रेकॉर्डिंग करते? हे बघा नाही दिसते.
नाही तिथून ऑनलाईन लाईव्ह चालू. रेकॉर्डिंगचं ऑप्शन आहे म्हणून तुम्हाला दिसतंय. तुम्हाला त्याच्यामुळे दिसतंय.
Should we start, ma'am? Okay. A very good afternoon to one and all. First and foremost, I would like to welcome our organizers and our chairperson for today, Dr. Urmila Gole, ma'am. She's associate professor in the Obs Gynae department of our college. We have all gathered today for the third lecture on menstrual hygiene of the Navratri web lecture series, focusing on women health and empowerment, organized by the Women's Cell. In Judy Gra's words, who is an American poet, activist, and scholar, menstrual blood is the only source of blood that is not traumatically induced. Yet in the modern society, this is the most hidden blood, the one so rarely spoken of and almost never seen except privately by women. Due to this unfortunate stigma associated with it, menstruation is treated as a taboo topic. So to shed light on this cardinal issue, I would like to welcome our eminent guest speaker for today, Dr. Surekha Tayade, ma'am. Ma'am is a professor and unit head of the Obstetrics and Gynae department at Jawaharlal Nehru Medical College, Wardha, and has been a teacher, trainer, and guide and mentor since the past 20 years. Ma'am is also the chairperson of Global Women's Health for Network USA. She is also the founding member and vice chairperson of Women and Health Together for the Future, South Africa. She is a national mentor, Quality Improvement Lakshya Program by the Government of India. She is a co-leader of Maternal Near Miss Project also. Ma'am also has numerous national and international publications and has received notable awards like Savitri Bai Phule Award and Dr. Anand Jivne Award. On behalf of the entire organizing committee, I welcome you, ma'am, and request you to please commence with today's lecture.
Thank you very much. The Dean Medical College, Ahmednagar, the organizers of today's very beautiful workshop which you are doing for Navdurga festivals, respected chairperson, Dr. Urmila Gauri ma'am, and all the organizers. I'd like to share my screen. Hope this is visible.
Yes, ma'am, it is visible. Yes, ma'am.
Let me start my lecture today by presenting myself as a person who has worked in the rural area since last 20 years and as a person who has been an advocate for women's health rights and an activist for women's health issues. I've been working in rural area of Wardha since last 20 years with lots of projects in the community and especially related to menstrual hygiene. My talk today is on sustainable menstruation, and I'll be talking about the various sustainable menstruation products which are available for us for menstrual hygiene management. This is my medical college, which is Jawaharlal Nehru Medical College in Wardha, and I bring greetings for all of you from here. And this is a beautiful, very beautiful mannequins which are there and virtual lab which is there in our department. Happy Navratri Day 3. And I believe that when we talk about Navratri festivals and when we pray to our goddess, we should also start respecting ourselves first and foremost, because the respect we carry out for women starts from us. First, we have to respect ourselves, and then only we can advocate for respect for women. So here is a beautiful lines on my own name, which I was forwarded by one of my friends. Surekha, which is my name, the beauty of lines. As I venture out, I become bolder. I become brighter and brilliant. I am aware of my limits, but I know they are not my limitations. They are my framework within which I can explore and expand the framework to mark new horizons if need be. So let us all start today this Navratri festival by respecting ourselves first, by finding out what are our strengths, and then move forward to venture out and gain respect for the womankind. Now let us go and talk about menstruation. What is menstruation? It is a natural, normal, biological process experienced by all adolescent girls and women. In any given day, more than 800 million women between the ages of 15 and 49 are menstruating around the world. Over 355 million women and girls are from India. That's a huge number. Menarche or first menses is attained at around 10 years of age, 10 to 11. Women menstruate up to 45 to 50 years of age. On an average, a woman menstruates for around 35 to 40 years. Can you please mute other people? The host, please.
Ma'am, I have muted, ma'am.
On an average, a woman menstruates for around 35 to 40 years of her life. And if you calculate 12 periods per year and then multiply 12 by 40, there are 420 periods in a lifetime. And if you calculate 5 days a month, 2 months in a year, that means 7 years in a lifetime a woman is menstruating. And that's a huge magnitude of time spent by women just menstruating. Let us look at the global scenario. 52% of women worldwide are in reproductive age group, and most of them thus are menstruating monthly. Still, the majority of them are not in conditions to take care of their menstruation in a hygienic manner, or they are impaired by it. Menstruation is supposed to be invisible and silent. We are not supposed to talk about menstruation. We are supposed to hide it because it is considered a taboo. There are various harmful restrictions. In some cultures, women and girls are told that during their menstrual cycle, they should not bathe or they will become infertile. They should not even touch or count or it becomes infertile. They should not look at the mirror or it will lose its brightness. They should not touch a plant or it will die. These are various taboos which are prevalent in so many countries of the world. Not only India, you can see in Afghanistan and Nepal, they can't eat certain foods. They have places they cannot visit and they are not allowed to cook. I do not wash my body, shower or bathe. That is from Afghanistan, from Gujarat, from Iran. I do not play sports. That's again from Nepal, Afghanistan, Iran, and India also. I have to sleep separately from other members of my family. I do not attend school. So these are the restrictions placed on women. Now, what about India? Why India must battle the shame of period stain? We have to remove the stain from Indian women. Discrimination against menstruating women is widespread in India, where periods have long been a taboo and considered impure. More so in rural women, we are able to see, more so in certain parts of the countries, more so in certain states as compared to others. They are often excluded from social and religious events, denied entry into temples and shrines, and kept out of kitchens. Here you can see this picture where the temple has this hoarding, attention, women are not allowed to enter the temple during menstruation, and then they say thank you. So that is the kind of discrimination faced by women. And many a times in my own OPD, I find women consulting me so that they can delay their menstruation because maybe some god or goddess is offended because of menstruation. But we need to ask ourselves, did the god or the goddess tell us that this menstruation is impure? No, God has given us this physiology. So let us consider this and stop all these beliefs and taboos. The very first period is celebrated in many parts of the country. You can see the celebration. The vagina is drawn out there as a goddess. However, the consequent ones become a matter of disgust, and these women are isolated when they are in menstruation. Don't think that this is not happening even in the 21st century. It is still happening in many parts of the country. Even in Maharashtra, I have seen many households which are isolating their girls and women when they are menstruating. Some are not allowed to water the plants or sleep in the same bed as their husbands, as if the plant is going to start menstruating or the plant is going to die. She cannot touch the food or that food will rot. So kitchen is off limits. And otherwise she has to do all the work, but when she's menstruating, she cannot cook. Isolation is all she experiences. Even the utensils she is served the food in are specially kept away from each other during the periods. If they are given the water in a glass of water, the glass is kept away from her. She's treated like an untouchable in many parts of the countries, even today. If she touches the pickle will spoil. As if the pickle is so very important than a woman's life, than a woman's respect, than a woman's dignity. So that is what is happening even in the 21st century. Apart from that, there is difficulty of assessing the sanitary pads. This is a major issue, especially in the pandemic. When there was lockdown, it was never considered that sanitary napkins should be the ones which would be considered as essential products. And so many women had problems when assessing the sanitary napkins during the pandemic, and they had to assess and use the cloth. According to one study, only 36% of women of 355 million menstruating women use sanitary napkins, while the rest use rags, husk, ash, leaves, mud, and soil, and such other life-threatening material to manage their flow. So this is a recent study. So don't think that everybody is having access to safe, hygienic material for menstrual hygiene management. This is what, till date, the 21st century, some women have to use even rags to absorb their menstrual fluid. What about the cost? Millions of families across India cannot afford to buy the menstrual hygiene product. You can see here, the food is available for ₹10, but the menstrual package for ₹30 per bag. So if she has only ₹5, will she go and buy food or will she go and buy the sanitary napkin for herself? So that is what is the dilemma of many families across India. Nearly 23 million girls drop out of school annually after they start their periods, according to a 2014 data of Indian scientists. This is a charity that works on the issues of adolescent health. Why they are having these problems? Because they fear of the stain which can be on their cloth. The boys, if they can laugh at them, and that's why they drop out. So now it is time we are realizing that menstruation is just a biological process and the secrecy surrounded must go. It is important to normalize menstruation and destroy the taboos around this natural process. And I am very much thankful for the organizers that this is the Goddess Durga festival season. And even during the Goddess Durga festival season, there's such a beautiful menstruation topic has been arranged by the organizers. So congratulations for picking up this very beautiful topic. Parental education. Education by parents about reproductive health, sexuality, and related issues is often a no-go area, leading to low knowledge and understanding in these issues. You can see if you're not educating your daughter, then maybe the next generation, the daughter's daughter, will also go through the same dilemmas. So we have to wake up and start normalizing menstruation, and दाग अच्छे हैं ये बताना हमें बहुत जरूरी है. Women sometimes may appreciate the management. This is a menstruation hut. As you can see, this is from Zulu area, Africa, because this is the rest period probably which is available for them from the intensity of the chores. The pain, the dysmenorrhea, which is accompanying the menstruation. We have to be sensitive of all these issues that women have to face. What are the disasters of poor menstrual hygiene? There could be infections, local infections, cervicitis. If wet pads are there, there could be skin irritation, there could be infection. Potentially the cervix and the uterine cavity also can be infected. And of course, all other, if not, the sanitary waste is not probably that there could be a risk of hepatitis C, attracting flies and insects. So many problems are there if there is poor menstrual hygiene. So now let us look at what is menstrual hygiene management. This definition has been given by UNICEF, and again, FIGO has also endorsed this definition. Women and adolescent girls using a clean menstrual management material to absorb and collect blood that can be changed in privacy as often as necessary for the duration of the period, using soap and water for washing the body as required, and having access to facilities to dispose this used menstrual management material. So that is what is the definition of menstrual hygiene management, and FIGO is actually endorsing that it should be available for women. There are three key challenges for menstrual hygiene management, and these are accessibility, affordability, and awareness. 70% of time, mothers themselves consider menstruation to be dirty. Material, 88% of women are using alternative materials such as rags, fabric, even sand and ash, wood shavings, newspapers. And facilities, you all know, all of us have gone through all this in schools. The household toilet also, many women are not having availability. 66% of women manage their menstruation in the open. And as far as schools are concerned, the facilities for toilet and washrooms is actually very pathetic. And that's why there is such a lot of problem for girls who are having menstruation at the age of 10 years and 11 years. You can imagine what is the malady they are facing. There is a term which is called as period poverty. Period poverty is a term used to describe the lack of access to adequate menstrual hygienic supplies. Federal aids, that the central aids may supply food, but they never supply the feminine hygiene products. The homeless have difficulty to access these products, and they of course use all these other alternatives which can cause to health complications, infections, and long-term health issues. So now what to do? The sanitary protection material. Any program which is aiming to support women or girls with sanitary protection material has to involve the girls also, or the women also, during planning, during decisions, and during discussions, so that they know what is their need, how it is to be managed. Like in the pandemic, women organizations should have been taken into confidence when there was lockdown, because the menstrual hygiene material houses also. Sanitation options. What are the sanitation options available? These are the options which are available: pads, napkins, biodegradable napkins also available, reusable cloth pads. Now menstruation cups are available. There are tampons, labial pads, home cloths, bamboo fiber pads are available, even banana fiber pads are available. And there are newer ones like water hygiene pads. I will be talking about each of them in brief. Now, what type of absorbents is to use? This preference is actually personal choice. It could be depending on the cultural acceptability, economic status, availability also in the local market. Sometimes the menstrual cups may not be available in the local market. Along with that, is there a sanitation facility available? One has to provide them with soap and menstrual absorbents to take care of their menstrual hygiene management. Of course, if you compare the rural and the urban women also, the choice of absorbent varies. In rural areas, the most preferred absorbent is a reusable cloth pad, whereas in the urban areas, the ladies may be using the commercial sanitary napkins. This is the sanitary napkins. Everybody is aware of it. Actually, it is a chlorine bleached kind of napkin. It may even use the sulfate pulp by manufacturers to produce a fluff pulp as an absorbent. Nowadays, many deodorized and non-deodorized, both sanitary products are available in the market made up of synthetic fiber rayon. These deodorized products contain chemicals like organochlorines, which have antibacterial activity. I will talk more about the advantages and the disadvantages in my later slides. This is a tampon, which is a kind of plug of soft material, usually it means cotton, which is inserted in the vagina to absorb the menstrual flow before it leaves the body. They are expensive. They are not easily biodegradable in nature, and they may not be environment friendly also. It needs some skill to actually insert this into the vagina, and we have to be very careful of the forgotten tampon or the forgotten sponge. We have to really talk to women when they're using tampons about forgotten term phenomena. Nowadays, sea sponge tampons are available in the market, which are a natural alternative to synthetic tampons. These are the reusable tampons, which are washable of natural material like bamboo, wool, cotton, or hemp. They are knitted or crocheted using natural absorbent material like cotton or wool. They are inserted into the vagina to absorb the menstrual flow, same as the disposable tampons. This is the reusable or washable cloth pad. They may be sustainable. They are the sustainable option, but they have to be hygienically washed and dried in the sunlight. The sun's heat is a natural sterilizer, and drying the cloth pad under it sterilizes them for future use. These cloth pads are reusable, so they are cost effective, they are easily available and eco-friendly. They also need to be stored in a clean, dry place for reuse to avoid any contamination. Some other options are, as you can see, this is the sanitary napkin made from banana fibers. This is from sea sponge, and this is another which is made from jute. So all these options are available, but when another material is being used to build these, to manufacture these pads, then somehow the cost is increased, and sometimes, many a times, the availability is not there in the market. So there are still challenges when we try to make other options available for women, and especially if rural women do not even know about this. What about rural, even educated women may not be knowing about other options other than the commercially available sanitary napkins. What do most of us use as a menstrual hygiene product? You and me, what do we use? Actually, we may be using the sanitary napkins, or some of us may be using the single-use tampons. Why do we use this? Why do we use the sanitary napkins? Because we consider it convenient, it is leak-proof, it is thin, it is hygienic, and no training is required to use them. However, we keep on forgetting that it is made up of plastic. It has some chemical. It may cause infection and rashes for some ladies, and inner part of the thigh may be having rashes. It can be associated with certain health problems like infections. There is that menstrual blood smell when the napkin is being used. They are, of course, non-biodegradable, can't be reused, can't be recycled, and they bloat in the water. And sometimes if they are thrown in drains, they clog the drains. So these are the problems with sanitary napkins. There are certain chemicals which are used in these pads, and one of them is styrene, which is used in car tires. There could be chloromethane, which is used in petroleum refinement. Acetone is used, which is also used in nail polish remover. Chloroethane also used in styrofoam. So these are all the contents of the sanitary napkins, which we actually never knew when we used it for ages. Certain health problems are there with pads like contact dermatitis, chafing of the thigh, and external genitalia. urinary tract infection, bacterial vaginosis, vaginitis, and of course that bad odor which is associated with periods. So these are, all of us women actually feel very ashamed of that bad odor which comes from the sanitary pads. And if we look at the impact on environment, it creates a huge garbage. All of us have seen this garbage lying by the side of the roadsides. This is a serious environmental problem with it because it is not recyclable, not reusable. When dumped in the landfills, actually it takes hundreds of years to degrade the sanitary napkins. And if you burn it, it produces dioxins and furans. So there is a huge impact of the sanitary napkins on environment. And we never ask ourselves who collects all this waste. All this waste is actually collected by another woman only. She may be a waste worker. And there we are causing huge health hazards to these waste workers. Their manual rag pickers are there who actually pick up the rags, pick up the pads from where we have thrown them. And what about these drainage system and sanitation workers? If the sanitary pads is flushed down the toilets, it clogs the drain. The gel in the pad actually swells. The sanitation workers has to enter the drainage system to clear the drain. Can you see this worker who has to actually enter the drain to remove the clog from the drain? So these are the problems. So what are the solutions to these problems? Let us look at it. What are the solutions? Solution could be a biodegradable single-use pad or a tampon. It could be a cloth pad, reusable underpants, and of course, very important and very beautiful ones is the menstrual cups. Still, many of us have not been initiated into the use of menstrual cups. I will be teaching you today how the menstrual cups look and how they have to be used. So these are the sustainable commercial sanitary napkins. First and foremost is the menstrual cup. Second one is the cloth pad. As you can see, various colors are there. There could be cloth diapers also. The children use diapers, but these are the adult cloth diapers which can be used for menstruation. So these pads, actually, these are the biodegradable single-use pads made up from organic cotton or bamboo fiber, and it is available in the market. Tampons also can be made from organic cotton fibers. These are composable. They break down quickly once they are disposed, and they can be used in optimal conditions. And of course, they are also available online. You can go on the Google and search for them, and you could be able to use them. So these are the biodegradable napkins which you can use. Now, what has government done for women and girls? Let us look at that. Biodegradable disposable Surekha pads have been made available by Ministry of Chemicals and Fertilizers. These pads are actually oxy-biodegradable, made available in packs of 4, priced at 2.50 per pad. So most of us do not know that these sanitary napkins have been made available by the Ministry of Government of India. Available across 586 Indian districts at the Pradhan Mantri Bharatiya Janashuddhi centers. This contains a special additive that renders the napkin biodegradable when it is exposed to the sun and air. The oxo-biodegradable napkins start decomposing 6 months after its disposal into a landfill. By comparison, an ordinary pad will degrade only after 500 years. The aim is to enable more women to have access to affordable and health menstruation products. So let us, start using these Surekha pads. Let us tell our own the community. When we go in the community, we can start using this oxo biodegradable, which is available by ministry itself. So these are the sanitary vending machines and electrical incinerators. We should look into it that our institutions also have these electrical incinerators. So at least our students of our college can use these incinerators, and these vending machines are available at least in our own institutions. These are the reusable period pants. These are leak-proof, odor absorbing, moisture wicking, and reusable, made from stain resistant antimicrobial fabric. So all of us, when you're using menstrual, material, we should know, and then we can, if we know, then we can educate our next generation about using these reusable period pads. What about cloth pads? These come in variety of shapes, colors, and sizes. They are waterproof backing made from polyurethane. Absorbent material is there in the middle layer, such as hemp fabric or bamboo. They are soft, and with proper care, they can be lasting for 2 to 5 years. Of course, a lot of care has to be taken to wash them properly, dry them properly, and store them properly so that they do not become a source of infection for us. But we have to start using it and ask our next generation to start using these cloth pads. As you can see, various varieties of them are available, and the cost also is affordable. Let me come to the very interesting part of my talk today, and that is menstrual cup. As you can see, they arise in various sizes and shapes, as you can see in the picture here. What about menstrual cups? These are healthy, these are greener, these are completely safe. They are similar to feeding bottle nipples. They are made up of medical silicone, and they collect the menstrual flow instead of absorbing them. If they collect, then you empty, and then you reinsert. They form a sort of a seal with the vaginal walls, and they do not leak. I can tell you from personal experience and personal experience of many of the people in my own community who are using menstrual cups that actually they form a seal and they do not leak. They are easy to use. They can be emptied. These period cups can be emptied at every 8 to 12 hours also. So if you want, if a lady is going to her own professional area, she can wear their cup in the morning, and only when she comes back in the evening, she'll have to re-empty it. This is made up of 100% medical silicone. It is hypoallergenic. It is used internally like a tampon. It can be emptied when it is full, that is every 8 to 12 hours. Can be used during the night also. So when she's sleeping, she inserts before sleeping, and during the night, she can have a very nice sleep. Can be used by everybody, including the virgins, that I can tell you with my own daughter who is 17, 18 years old, who is using the menstrual cup. Easy to clean, easy to use. One cup can last up to 10 years when used with care. So only a single time you have to purchase the cup, and it can be used for 10 years. Of course, it is going to save the environment, because the pads and the tampons, they are getting thrown on the waste. And of course, menstrual cup can last for at least a year or more. Even 10 years, people have been using the menstrual cup. And compared to that, the pads has to be thrown off, and they have to bought every time for every use. So you can see how much you can save the environment if we start educating our community about menstrual cups. It saves money. A lot of money is saved. You start calculating how much money you're spending on the sanitary napkins. Money spent on sanitary napkins in 10 years would be 12 to 45,000 if you start calculating. However, if you buy one cup, it's going to last for you for 10 years. So one reusable cup can be used to 8 to 10 years. So it is saving lots and lots of money also. And of course, the accessibility, if the sanitary napkin is not available, what do? You start using the cloth. But if you keep that menstrual cup with you, there will never be a problem of accessibility. What about if we are into sports, we are cycling? What about active women? If you want to run a marathon, no problem. If you want to hike a mountain, if you drive a cycle, no problem at all. You can still use the menstrual cup, and it is not going to leak if you train yourself to use it properly. Even you can participate in all kinds of heavy work also, and sports also. You can teach the women of the community to use this menstrual cup. Even the rural women, you can teach them how to use, and they will also be able to use it. Of course, there will be no more dry vagina because the tampon absorbs the blood for your period, but also it absorbs all the moisture also. So many a times you'll get dry vagina with tampons, but not with the menstrual cup. They won't leak. Initial few cycles, when you're actually learning to use the menstrual cup, there may be a problem in the first 2 uses itself. But once you learn, you have a knack of using the menstrual cup, then there won't be any leak if properly the seal is formed. You can change it on the go. Suppose you are traveling somewhere, you have to dispose of the contents and just empty into the toilet, wipe it with some tissue and reinsert it. So even if you are traveling, you may change it, and you do not need much amount of facilities to actually change this menstrual cup. They're easy to clean. Just wash it under running water. So as you can see here in the picture, you can wash it under the running water. You can rinse it, and then again, you can reuse it. So it is a wonderful thing to have for ladies if you can initiate yourself to start using the menstrual cup. They are easy to empty also. Just you can throw the material into the toilet or in a sink. You can wash everything very nicely and reuse it. And of course, you can keep track of how much you are menstruating. Are you menstruating more? So you can measure it, because these menstrual cup, as you can see how they look like, these menstrual cups, I don't know if it is visible. Yes. So this menstrual cup looks like this. It is calibrated here, and you can measure also how much amount of blood is the lady is bleeding. So unlike pad, you can tell your doctor if the menstruation the flow is heavy, and you can keep track of how much you are menstruating. So you will be having the question, how much menstrual blood does a cup hold? So normal period, if it is a 50 to 80 ml, each menstrual cup, as you can see here, holds 15 to 23 ml. You have to empty it every 6 to 8 hours. If the bleeding is heavy, you may have to empty it even in 4 hours. So that depends on how much amount of bleeding is there, and that will allow you how many times you need to wash and reinsert it. So as you can see in this video, I'll be showing you the video. It's easy to use. Once you get the hang of it, initially you may have a little bit of problem to learn it, but of course, once you learn it, you'll find that it is easy to use. Let us watch this video. So you have to sit in the squatting position or stand with one leg on the WC. You may even sit on the WC. And of course, you have to reduce the size of the cup like this, okay? And insert into the vagina directly. It should go completely inside the vagina, and no part of it should be visible from outside. And it should fix actually on the cervix, the under cervix of the cervix. You can see it goes into the vagina and it hangs itself, makes a seal in the vagina, and the blood gets collected into it. So it's quite easy. As you can see here, the cup is there. You can either reduce it, fold it like this and reduce the size of the cup like this, or you can just dip your hand like this, and you can reduce the initial small part here and go into and insert the cup into the vagina. The cup has to actually go high up into the vagina, and no part of it should be actually visible. This small stem of the cup is actually so that you can trace the cup, and when you try to remove it, the stem is hidden. Some of the cups actually, the one which you are seeing in the video doesn't have the stem. However, many of these cups will have the stem here, as you can see here. We'll go to the next slide. And the next slide is about how to remove it. So what I have told you till now is how to insert it. So insertion also, you will take maybe 2-3 times initial time. It will take some time. For the married ladies, it's not a problem at all. But for the uninitiated, unmarried girls, if they want to start using it, then you have to tell them to be little patient And initial 2-3 times, they may have a little bit of apprehension, but once they start using it, then there will not be any problem. Now, how to actually remove the cup? You can watch in the video. So for removing the cup, you have to go inside and actually break the seal. That's important. So for breaking the seal, you can see here that you have to dip your hand and go inside like this. I'll tell you again. Let's watch the video first. Right. So you have to follow the stem, go to the cup and pinch the cup like this. Pinching the cup will actually break the seal, and then you can remove the cup. You have to teach the ladies not to remove the cup without breaking the seal, because it forms a good seal with the vagina, and actually it hangs like this with the cervix also. So you have to ask them to pinch this part, break the seal, and then only remove the cup. You can see that at the top of the cup, where the rim is there, small holes are there, which actually creates the vacuum. And this is also useful for breaking the seal. So you have to break that seal, and then only you ask them to remove the cup. So this is a very beautiful thing which you have to teach the ladies when you ask them to wear it. Now let us look at this video. What are the problems why there is leaking? Sometimes why there is leaking, if you're not inserting the cup fully inside, then probably what happens is some part of the cup is visible outside, or you can palpate it outside the vagina. And that's why probably it has not opened up very well. And what you have to do, just pull the cup a little bit and again reinsert it. Maybe the cervix is not properly inside, and because the cup has not opened up, and that's why there is leaking. So what you have to do, remove it again and then re-push it inside, and you have to then learn so that you put it nicely inside the vagina and it opens up. If it's not opening up and forming the seal, then it is going to leak. Okay, so maybe initial first 2 periods, you'll have to use a pad also along with the menstrual cup so that you learn it. Okay, so these are the problems which can happen and it can lead to leakage, but you will learn with your first 2 cycles, and then later on you will be so happy when you start using the menstrual cup. Lubrication, do you need to use any chemicals or creams? No need. You can use the tap water itself in the washroom. And of course, there is a learning curve. 2-3 cycles may be needed to learn. Removal, you'll find a little bit messy, because when you use a sanitary napkin, the blood doesn't, spill on the floor. But initial few periods, you'll find from the menstrual cup, the blood is spilling on the floor. And you think that it is messy, but then you'll get a hang of it, and you will learn that once learned, these women actually prefer not to get back to disposable pads or tampons, and they feel that the menstrual cups are very, very comfortable. So are you scared of using? There is no need to be scared. If you are comfortable with intercourse, then inserting the cup is actually very, very easy. The vagina is 12 centimeter long and the cup is only 6 centimeter long. So relax, keep a positive attitude and start using the menstrual cup. Many a times I find that women buy the menstrual cup, but they're apprehensive to start using it. They'll keep it in the cupboard for a few years maybe, and then maybe a talk is given by somebody like me or any other person who is an activist for menstrual cups, and then they will bring out that menstrual cup from the cupboard and start using it. So no need to be scared. It's not difficult at all. I can vouch that even my own daughter, she's using the smaller cup. Of course, there are various sizes of this cup which is available. This is the average size which can be used by married women. For unmarried girls, you have a smaller size available, and that size can be easily inserted in the vagina. So no need to be scared. You start initiating yourself to use this menstrual cup. And of course, start using it, because no trash, no rash, and no cash. So you will be benefited by everything and start using it and become a part of the allied group of enlightened women. It's very, very comfortable. No need to remove it for passing urine or stools, unlike with pads. It requires less frequent removal. It is not affected by rain. Also, if you get wet, don't think that something is going to happen. And you don't feel like that you are using anything or wearing anything at all. So it is that comfortable. So you don't even notice that it is there once you get the hang of it. And, even in the night, you can sleep well. Let me tell you about the menstrual cup project, which I have been running in Wardha district. Actually, this project I have started with an institutional intramural grant, which was an interventional study, which was I did. A sample size was 200. It is still ongoing. Menstrual cup is costing 500 rupees. And this 500 rupees cup, which is made, this comes in boxes like this. So this box is available and the cups are like this. So it is available and it comes, various cost is available in the market. If you go and Google it, it can come even at 200 rupees cup is available. But we should make sure that you buy a good quality cup, because it should last you around 5 to 10 years of time. And of course, we are providing this cup free of cost to the women who have participated in the study, and we are obtaining the feedback from this. So this is a menstrual cup project which we are running in Wardha district, and the women have given very good feedback. Rural women are being able to use it very, very beautifully. So and this is how the movement was started in Wardha district, and even our own department, faculty and postgraduates and nurses and everybody has started using the menstrual cups, which we have provided to them. We have given a lot of training to them also. So the choice is yours. What do you want to use? How do you want to achieve a menstrual hygiene management? The personal choice is yours. What kind of option you want to choose for yourself? So start where you are, use what you have, be an agent of change. That is what I would like to suggest to you, all of you who are listening to the lecture today. And any help is required to choose any menstrual cup, or any support is required when you start initiating the use, we have a WhatsApp group actually of menstrual cup users who can tell you about their own experiences and help you, support you in the first 2 times, maybe first 2 cycles when you start menstruating and using the menstrual cup. Let's strive. We are today there as a part of a goddess festival here. So let us strive to educate for women's health issues. Let us pray no Durga is aborted. No Saraswati is taken away from school. No Lakshmi has to beg for money from husband. No Parvati is sacrificed for dowry. No Shakti has to be a victim of physical abuse or rape. And no Kali is given fair and lovely to use. And let us hope for good menstrual hygiene management by our women and girls of our community. Thank you very much for your patient listening.
Thank you so much, ma'am. It was a wonderful lecture, and we have surely imbibed a lot of new and valuable information today. Now I would like to invite Dr. Urmila Gaule, ma'am, to summarize the lecture. Over to you, ma'am.
She's muted. Madam, please open up your audio and maybe your videos.
Ma'am, just 2 minutes for this, please.
Any questions from the participants till that time I can take up? If they want to ask me something about the menstrual cups, its availability, the cost, I can take up the questions. Yes, now you can see you, ma'am, but you're muted.
Good afternoon, all of you. I will first like to congratulate Dr. Surekha Tayade, madam, for this wonderful lecture. This topic has always been close to my heart as well, because being a gynecologist, as ma'am has also must have experienced young girls coming with so many rashes, or some of them coming with the infections, and then we have to explain something as basic as menstrual hygiene to them. And it always, I found always that very disheartening, that something so essential and is routine, that every month they are going to have bleeding, but they are unaware how to take care of themselves. And who doesn't know from our personal experiences, like when we had our first periods, how shy, and what all information we gathered, we never gathered from our relatives or our mother. It was always from other sources which were unreliable, and a lot of fear and myths and taboos were because of the information was coming from the wrong sources. So I totally congratulate for first highlighting this point, that we need to talk about it. It is a routine process, how the childbirth and how pregnancy is celebrated. It is a prerequisite to the pregnancy. Then why menstruation is not celebrated, why it is not talked about, right? It is a sign that the woman is healthy if she is menstruating. Then why there is a taboo associated? So first we need to talk about, we need not discriminate them, we need not exclude them from social events. As madam rightly said, we get women who want to postpone their menses because some festival is coming or puja is there. So that part of the lecture was, I think, is the beginning. If we want to implement anything in the menstrual hygiene, the first part is that we'll have to stop discriminating women, and we'll have to start talking about it as if like a routine physiological process and not something that is abnormal. Even while talking, we'll have to be sure that it is a physiological thing and not something that is abnormal. And madam really talked about how it is affecting our young girls. They are dropping out from their schools. There are a lot of infections they are getting. So it has a lot of health implications also, serious health implications. And definitely it affects a woman mentally also. You know, so many fears are implicated into her mind at a very young age when they menstruate. So they think that they really think, you know, in at some part of our life we also thought that we are untouchable at that time. Let us not lie about it. At those young age we also thought that we are untouchable at that time. And madam, I think that what I liked about it is the three keys that she said, that we, if we want to improve it, first there has to be awareness about it. Second, it should be available, you know, at the local market. I think that is also a very important point. Even now, a lot of women do not have access to the good. And as madam had pointed out, the sanitary pads that we talk about, they do lead to a lot of rash, you know, though it is promoted quite a lot on the television. And every person who does not have good access to the information, they are likely to buy those pads, and they are not aware how frequently they are supposed to change it, you know, because they are costly. They are using it for 24 hours because they are costly, and that is leading to a lot of infections and rashes, you know. So this is very important, that it should be at cheap level, it should be available. So government is playing role, but I still feel that the role is far too on a smaller scale. I feel it has to be increased. If you are saying 50% of the women at any time are menstruating, then definitely the role has to be bigger, wider, and quite open in the field, you know. It should not be we have like small projects are started. It has to be on a global level, so that the pads that are accessible. And I think the last important point was that how these pads are not biodegradable. And right now when we are talking how environmental friendly, like we are everywhere, we are trying to reduce the use of plastic also. So this is really good, but I personally believe these cloth pads and bamboo pads and all that, honestly speaking, I'm yet to see any of pad which is made up of banana leaf or this, because it is not available. It is there, but it has to be available. So I think that my first, I think since madam is part of this movement, I think making it accessible, you know, it will be the very important thing. Like awareness is created through these lectures, you know, and we all can join the team, and we can train our faculties, and we can train our residents, so they, when they become doctors, they all can train. But it has to be available. We just can't keep on telling that you have to do this, and then she's not finding anything, you know. And the solution of that can be the menstrual cup, which is a new thing that has come. And honestly speaking, even now I had before this lecture, I had my own doubts about it. I have never used it. I have never ever recommended it, to be really honest, because I had so many queries about it. Because I used to find, if the women are not knowing how to use the sanitary pad, how are they going to use the menstrual cup? For a simple infection, I prescribe them pessary and I have to tell them 10 times how to insert the pessary. So this is a good initiative with the videos and all that. I think I will believe before the uh, common ladies, I think we'll have to train the gynecologists like me, and we'll have to sensitize that yes, it can be used. I think when more of us will be like happy with it, and we'll see how it really is affecting positively not only our health but also the environment, then I think more and more of us will be promoting it to our patients also. So that is a very good thing. I had plenty of doubts about menstrual cup and queries, and I'm really ashamed of my lack of knowledge on it before the lecture. But I'm really glad that Madam has touched it very beautifully and has removed my own apprehension and fear and myths about the use of the menstrual cup. So I think, Madam, we try to involve as many as gynecologists as a part of this, movement, so that we all can get sensitized and we can, contribute little bit from our side when we counsel a patient. Like a patient will come to me and ask about menstrual. I'm like, okay, I don't know anything about it, but now afterwards, now I know little bit about it. So that's a very good thing for sensitizing us. And I think every lecture is a good lecture when the audience had entered it with a different mindset and lives with a different mindset. So I think I'm benefited, and something belonging to the real fraternity who deals with this condition. I'm enlightened with Madam's knowledge, and I'm really hoping forward whether I can really be part of this movement, and I will definitely try to know more about it. So I thank you, Madam, for introducing this menstrual cup and highlighting and stressing on it. It was not just one touch and go. you know so you stressed on it, which I really liked. It removed most of the queries in my mind, and I congratulate ma'am on this, and I really thank the organizers for this particular lecture. And thank you, Surekha ma'am. And let together, I think we all can really
Just wanted to say a few things, Dr. Urmila, very nicely summarized. Just wanted to say that as a part of the project which we are running, because many times what happens, people will ask me, where is it available? Is it available for me? I want to order it. So I can just tell you, you can go and Google yourself. And we buy so many clothes from Amazon. It is available on Amazon also. And you can just go. And what my recommendation and suggestion would be that many cups are available even at 200 rupees price. But when you're buying your first cup, see to it that you buy something which is, having a good, the company should be good, and it should not be a cheap product. So anything, around 800, 900 rupees to 1,000 rupees, I think would be of good quality. And so I can share with you the various kind of cups which we are using. This one is the Serona cup, which we are giving free of cost. And there's another medical college in Ahmednagar, which is the Rural Medical College, Loni. And I have shared around 20 cups with the faculty and residents there, so they can start using it. Because as rightly said, if us doctors are not using it, how can we promote it in the community? So I have even given some talks in the Arts and Science College in Ahmednagar and few of the colleges there, and I have made it available. Because I can really tell you from personal experience that when you once start using it, you'll never stop it. How comfortable it is, how easy it is to use. If you don't use it yourself, you'll never know what you're missing. And sometimes I feel that I came to know this at the age of 49 and 50. If would I have known it earlier. Now I have initiated it for my own daughter, so I can always say she is now a cup worter. Means what? One person who is converted to the use of cup, and she is so happy with it, and she is so open about it. I'm telling you, she's so open about menstruation. She'll tell everybody, I'm using the menstrual cup, and proudly she'll tell you she's just 18-year-old. And she's happy with it. So if she can use it, I think we can teach others also. And without fear, we can start initiating ourselves And if we don't use it, I don't think that we can promote it in the community. And there are such a lot of advantages. So if you talk of sustainable menstruation, I think the menstrual cup has to be used and we have to promote it. Thank you very much for calling.
Thank you, ma'am, so much for this. We all have gained a lot of information, and we are definitely sensitized in a different direction than what was expected. And let us hope that what you are talking about, how freely your daughter can talk, that let that be the scenario for everyone in the near future. Thank you, ma'am, so much for coming.
Thank you so much, ma'am. Very well said. Now I would request Dr. Namrata Marathi, ma'am, to conclude today's lecture.
Thank you, Nandini ma'am. On behalf of Dr. Vithalrao Vikhe Patil Medical College and Hospital and Women's Cell Committee, we organizers would like to thank our Honorable Namdar ji, Shri Radhakrishna Vikhe Patil ji, Khasdar Sahib, Dr. Sujay Vikhe Patil sir, for giving us this opportunity to conduct this lecture series. We would also like to thank our Deputy Director sir, Dr. Abhijit Divte sir, our Secretary General sir, Dr. B. Sadananda sir, our Dean of Medical College, Dr. Sunil Natha Maske sir, and Women's Cell Committee members for successful completion of today's lecture. We also thank our today's guest speaker, Dr. Surekha ma'am, for giving such a important, valuable information regarding menstrual hygiene. And ma'am, we are really thankful about this new information. Even we females are not using being a doctor, and it is really, really helpful for all of us to promote also and to use also. I'm also thankful to Dr. Gauli ma'am for chairing this session. And last but not the least, all the audience who join here for this webinar. So really thankful to everyone for this lecture, attending this lecture. And ma'am, very much thankful for taking out your time and bringing this important information to us. Thank you so much, ma'am. Thank you. End the session.
Thanks, sir.